Manju, no. Okay. This is. First of all, greetings from Quality Maternal and Newborn Care Research Alliance. And it's our honor to be part of the 15th International Normal Labor and Birth Research Conference, which is on virtual mode. And the theme is very aptly selected, pandemic, pregnancy, positive birth. We all know that all journeys were put on hold except birth. And on behalf of the Alliance, myself and Alison are going to speak on the priority one, research area priority one. So this research alliance, before going into the alliance and priority one, we would like to introduce ourselves. I am Professor Manju Chugani, working as a former dean and nursing professor and head of the Department of Paramedical Sciences, Jamia Hamdard. And I'm basically a midwife working for the last 30 years on this agenda in India. And now I would request Alison to introduce herself. Over to Alison.
Hello, everyone. I'm Professor Alison McFadden. I'm Professor of Mother and Infant Public Health, and I work at the Mother and Infant Research Unit at the University of Dundee in Scotland. And I'm a midwife, and most of my research focuses on the quality of midwifery care. Thank you. So, Manju, would you like to tell us about what this priority is about?
Yeah. Thank you. This priority is basically working on midwifery and other care models, in which we are trying to investigate the impact of quality maternal and newborn care, and in particularly the contribution of midwifery on maternal, newborn, and related outcomes across diverse settings. And now I would request you to tell the audience, explain it to the audience, the framework for quality maternal and newborn care on which you all have worked so hard to come out to be in this shape, to bring out the framework in this shape. So may I request you to explain the model to the audience?
Thank you. So this framework came from the Lancet series on midwifery. It's an evidence-formed framework, and it forms a foundation, a conceptual foundation to examine and compare models of care, any model of maternity care. So it can be used to design research studies, it can be used for analyses, and it will, if we use this framework, it will provide some consistency in research where we compare different models of care. And we can use it to look at what care is provided. So that's the top row, the practice categories, how care is organized, is it available, is it accessible, is it good quality, what values and philosophy underpins the care, and who are the care providers. So thank you.
Yeah. Thank you so much. There's one more question to you regarding the assumptions of priority one.
So when we thought about this priority, we thought there are some assumptions that we have in thinking about answering the question. And the first one is that women, communities, advocates and health professionals should be at the centre of our research, and they should be involved in designing it and carrying it out. And then starting at the top of the circle with the models of care, we need to look at different models of care and compare them. And midwifery models of midwifery care should over time lead to reducing over intervention and over treatment. Care should also focus on strengthening women's capabilities, that is, their capability to look after themselves, their babies, and their families. We also need to examine what are the mechanisms of effect. So how does quality care lead to better outcomes? And in our models of care, where is the best place to provide care? So it might be place of birth, but also care during pregnancy and postnatally. And where's the best way to provide care for people, for women who can't access facilities? And then finally, the model, we know from studies in high income countries that midwifery-led continuity models lead to better outcomes for women and babies, and that's based on relational continuity. So that is the relationship which a midwife forms with a woman throughout the continuum from pregnancy through to postnatal care and beyond. So Manju, can I ask you to give us some examples of research questions that we could look at under this priority?
Thank you. We worked through one of the workshops and came out with these research questions, which can be worked out, or we can think of these research questions. The number one is, what are the features of models of care that provide optimal clinical outcomes and positive experiences for women and newborns across all settings, and how can these be scaled up? This is the first priority in the questions when we were working during the workshop. And the second is, what are the outcomes of different models of midwifery, including midwifery led in middle and low resource settings? Third is, what are the barriers or facilitators to implementing midwifery models of care, including midwifery led continuity of care? And fourth one is, what strategies could be used to upskill the midwifery workforce to provide the full scope of midwifery? And the last one, which we thought is, what kind of community birthplaces are optimal for healthy women and newborns, and how should these be embedded in the wider health system? You heard the assumptions, and then you can correlate these research questions as well. Then there are key initiatives which you can think of, the research questions. How can you contribute, and what are the areas? For example, to achieve, you can take part in funding research projects by alliance members that address this priority. Then you can be an advocate to funders to frame calls for research, or to commission research studies related to this priority, broker new research partnerships between alliance members, and promote the priority as suitable dissertation topics for master's and doctoral studies, which we can easily do it at our own level at the college or at the university.
So to finish our presentation, I'd just like to thank you for listening, and to ask anyone who's interested in this priority to join our group, sign up to the Alliance, join our group, and we look forward to collaborations and to exciting new ideas and to working with you on new research under this priority. Thank you very much.
Thank you very much for patience hearing. Thank you.